Thank you so much for having me. I am the Child Death Review Subcommittee. We do now have the State Mortality Review Committee, which oversees all the mortality reviews in the state. So that includes the child death review, the maternal mortality, as well as the domestic abuse death review. So just over the last year, we've had a little bit of a change, but our work does continue. I'll just do a little history and purpose of the child death review and then go over some of our most recent data, which unfortunately is 2020 data. So we are a little bit behind. We got behind during COVID. We weren't able to meet due to the sensitivity of the data and the way we were set up at the time. And then we lost another year last year in response to the legislation and getting everything set up there. So we are committed to getting caught up. So we are doing 3 years of data right now. We're reviewing 2021 through 2023. And as soon as those 21s are done, then we're going to be doing 22 through 24. So we will get caught up and be a little bit more timely, but I still think that this is some important data. So child death reviews were set up in the mid-1990s in response to child maltreatment cases, and Iowa was right in the midst of that. In 1995, it was set up through the legislature. It's in all 50 states, some territories, and some of our tribal nations as well. Some states, like Wisconsin, have local teams, so they're more like county-based or smaller teams that way, geographically located, and some states have state teams, like Iowa does. This is our membership. This might be a little small. The main takeaway here is you may recognize some of these folks, but we are a very multidisciplinary team. And so we have folks from law enforcement, the legal system, Department of Transportation, healthcare providers, substance abuse, all just across the board, stakeholders and people with expertise in the manners and causes of child death. So it's a public health prevention and future-oriented process. So we don't sit down and decide like this case needs to be taken to the county attorney and these people need to be prosecuted. We don't retry cases. Those are not our responsibility. So we're really trying to be more system focused, making sure that we are looking above, it's probably human nature. It can be hard to not look at like the parents or the last people to sort of touch the child and place responsibility there, but really trying to pull that up to what was the system that those parents were making those decisions in. And so we really are trying to work more and more on the system level, not assigning blame. And as I already said, we're not, here to retry cases. So if you have a case and you're like, I just don't think that was done correctly, we're probably not that safety net that you think we're going to be. We're really looking at how can we prevent future deaths based on the data that we have from these prior cases. So which cases are reviewed? All children live birth through 17 years of age who died in the state of Iowa. So if they're a visitor to our state and they die while they're here, then we'll investigate that death. Not investigate, we'll review that death. And if an Iowa resident is in another state when they pass away, then that state will review that death. So we have an average of about 280 deaths annually. And there are 5 main classifications of manner of death, and those are accident, homicide, natural, suicide, and undetermined. And so we review all of those manners of death, and all cases are reviewed by staff members. So myself, we have a data abstractor. So those cases, and by abstracting, meaning we look at all the records that we have and we're pulling out the pertinent details. And then that information is entered into the National Case Reporting System. And then we do statistical analysis with that data that we have and make recommendations to the State Mortality Review Committee. In addition, cases that are manner, accident, homicide, suicide, and undetermined are individually reviewed by a child death review team member from that list that you saw at the beginning. And then we group review that in our meetings. We go through those cases and talk about what happened there and what our recommendations around prevention can be. So that's how that happens. We as staff request or access records for the cases and provide those records to the members. So we we're accessing law enforcement, healthcare, the autopsy. If we can get, if there are child protective services records, we're accessing those. If there are juvenile justice records, we're accessing those. We also look at some public stuff too, like Iowa Courts Online or the obituary. Sometimes the obituary can give us some nice information just about who the child was, and instead of all of that sort of death-related information, this was a child who really enjoyed butterflies and bicycling or something like that, to kind of humanize the cases for us a little bit more. And then our members are assigned those cases to review prior to the meeting. And then during the meeting, we actually, really focus on recommendations for prevention and provide those then to the State Mortality Review Committee. So that was kind of an overview of the process and who the group is. So now I'm going to go over our 2020 data. So for a very long time, prematurity, developmental and genetic conditions present at birth are by far the major manner of death and cause of death. So it's over 35%. It's even closer to 50% of our deaths. Followed by accidental strangulation and suffocation in infants, which you might know of more commonly as SIDS or SUID, sudden unexpected infant death. These can also be infants who maybe strangle on something in the bed. So it's really what we also call our unsafe sleep deaths. So that is the second leading cause of death for all age children, and that really only affects those 1-year-olds and under. And then followed for the first time, tied for second, is actually intentional injury. So forever, it's been motor vehicle, but in 2020 here in Iowa, as well as nationally, intentional injury, largely due to the increase in gun violence and firearm fatality, has risen to the second leading cause of death for children in Iowa. So this shows from the early 2000s to actually 2023 data that you can see that we've had a 69% decline in natural deaths, and that's really related to advancements in medical care. And then this next slide is the same slide, but with naturals removed. So as I said, naturals make up close to 50% of our deaths. So it's hard to put that into a chart with these other deaths and then see the more trajectory here on these other causes. So you can see we had a nice drop in accidental deaths up until the mid 2000s, and then it really leveled off. But we're having a significant increase, actually a 69% increase in suicide fatalities over that same time period. So some key findings in our 2020 data: asphyxia in infants, that unsafe sleep, that accidental suffocation or strangulation in bed, all names for, similar situations. We had 35 of those in 2020. It's the leading cause of death from a non-natural cause for all children, which surpasses the number of children who died in a motor vehicle accident. So again, that first year of life compared to an entire childhood of motor vehicle crashes. And I've said this statistic several times now already, that half of all child deaths occur in infants under age 1. So some of the circumstances around those unsafe sleep deaths: 49% occurred on an adult bed, 40% had pillows in the sleep environment, and we had a data anomaly in 2020 that's quite concerning. So we had 7 infants die in Iowa on those U-shaped nursing pillows. You might know them more commonly as a boppy pillow, but there are several brands. So U-shaped nursing pillows, they're great for positioning the infant for feeding, especially for nursing, but can be used for other feeding. But they're really unsafe to be used in any other sort of situation. So Child Death Review really recommends that those only be used for positioning infants during feeding by an alert caregiver. So just to put this a little bit into perspective, you may remember about 15, 20 years ago now, there was a redesign of all pools and spas because there were incidents of children being sucked to the bottom of the pool and held by the pool suction. that redesigned the entire industry for all pools and spas, and that was based on 7 fatalities nationally over several years. So we've had 7 infants in a single year in a single state die on a boppy pillow and or a U-shaped nursing pillow, and those products are still available. We're not redesigning that industry. So if you've got folks that you are in their lives, either professionally or personally, and they're not breastfeeding, help them get rid of that pillow. So 48% had blankets, comforters, or other plush objects in the sleep environment. 35% had documentation of breastfeeding. So breastfeeding is a powerful risk protective factor. So you can see about a 50% reduction in unsafe sleep deaths or SIDS deaths with breastfeeding, even as soon as 2 months. So breastfeeding for 2 months, and it doesn't even have to be the only source of food. So you can have intermittent breastfeeding, and it really provides a strong protective factor. So another good reason for families who can breastfeed to do so. 37% had documentation of exposure to tobacco smoke, which is a risk factor. 29% were Black and 50% were white. So this really is sort of a white infant issue for the most part. You're going to see the majority with white individuals, but we don't want to lose track of the fact that we do have a disproportionate number of Black infants dying of unsafe sleep, as the Black population in Iowa is about 4%. So it's a pretty significant disparity that almost 30% of the infants are Black that are dying in these unsafe sleep deaths. We also had another anomaly in our data. So forever, it's been 60% male, 40% female dying of unsafe sleep, SID, SUID. And nationally, that continues to be the case. But here in Iowa, we have actually seen that flip. And so we are at 54% female, 46% male. We don't know exactly why that is or what that means. I don't know that it's going to change necessarily any of our messaging or things that we're doing, but it was an anomaly in our data that we are looking at and trying to make some sense of. In the category of early childhood maltreatment in 2020, we had 7 children 5 years of age and younger die of child maltreatment. In comparison, 10 children died in a motor vehicle crash of that same age. Fewer than 6 died from other accidental causes, excluding accidental strangulation and suffocation in bed. So you're seeing similar numbers for unintentional injury and intentional injury, which is something that we should be looking at in prevention as well. For our adolescents, 10 to 17 years of age, intentional injury deaths at 29 surpassed accidental at 24 and natural deaths at 17. Again, this is likely due to the increase in firearm fatality. Our death certificate data from vital records is showing death by suicide continuing to increase each year through 2023, with an average of 22 deaths by suicide annually, the highest 5-year average since CDRT began. So we're seeing a significant increase in suicides. I will tell you, our preliminary data that we just received from Vital Records on 2024, we had half the suicides in 2024 that we did in 2023, which is great news. But we don't know if that's going to be just a single year dip or if we're, doing things to really reverse the trend of that 69% increase since the early 2000s. So something to keep an eye on, but it is encouraging to see that in 2024, we did have a significant drop in suicide fatalities. Something that we're really looking at, our preliminary data that we just looked at in 2022 and 2023, we had an increase in off-highway vehicles. So those would be primarily like your ATVs, UTVs, but also things like dirt bikes and go-karts, those kinds of things. That has increased 67%. In 2022, the legislature made it legal for licensed adults going 35 miles per hour or less on a registered off-highway vehicle to drive on the road day or night. And that's really presented a cultural shift. Obviously, our child fatalities that doesn't encompass them at all, right? It's still not really legal for them to be driving on the road. But that sort of opening it up culturally, people feel like, okay, it's safe to drive on the road. And so we've seen a 400% increase in OHV fatalities since 2019, with that huge spike after that legislature code change in 2022. So something that we are looking at how we can work to prevent these deaths from continuing to increase. We do see some health disparities. 61% of children dying in Iowa are male, and you can see the breakdown there where we have the different disparities. The only place where we're having more female children dying than male children is, as we said earlier, in that unsafe sleep category, and then child maltreatment. And our Black children are dying at more than 3 times the rate of white children. This is a change in infant mortality. It's kind of a complex little slide here, but you can see from 1995, which is that bottommost row, that are to the top row, our total there in 2020, we've seen a significant decrease in infant mortality, but you can see that that is not across the board. So some of our racial and ethnic groups are not experiencing the same level, and some of them have actually seen an increase over that same time period while the total has decreased. And those are my slides. So I'm going to stop sharing and then open it up for questions.
I had a question on that slide where it said 400% increase in off-road vehicles or whatever. Is that all populations or is that just youth?
Just youth. Although I did see some media things, DOT and DNR are also concerned across the population. There's been a significant rise in accidents and fatalities since 2022. But I don't know what the actual numbers are for them.
Do you guys do reviews on deaths for children based on health conditions?
So those health conditions, assuming sort of like a natural, like cancer, the congenital anomalies, prematurity, those kinds of things, those are reviewed by staff and entered into the national database. And then we use statistics are included in our annual report and those kinds of things. We don't do a group review of those deaths.
Gotcha.
I have a question. This is Kristen Oaks. You had mentioned the U-shaped pillow. If they're not breastfeeding, to get rid of it. Is it still appropriate to feed the baby with it on your lap?
Yeah, I think some families find it useful for feeding. And so, yes, we would, if that's how they're using it, that's fine. It's just, it was designed to really help with positioning for breastfeeding, but it can help some with positioning for any infant feeding.
Sure. Okay. Just want to clarify that was kind of what you were talking. Thank you.
For the 48% that you said that with the sleep deaths, unsafe sleep deaths, what age was that with the blankets, comforters, and plushies? Was that just babies that can't roll over?
So the unsafe sleep deaths is only, the only eligible category is infants under 1. But we do see 2/3, so 66% of those deaths occur in the first 4 months of life. So in the greatest risk period, traditionally they've been talking about the first 6 months, but it really is those first 4 months is the highest risk.
Do you guys have I guess I see that with my families is that they have their babies sleep with them often. And do you have any, I guess, slides besides this or training or anything that I could do to try to help them understand the importance of having their baby sleep in a crib or a bassinet?
Yeah, so the nationally there's a lot of back to sleep, campaigns, sort of brochures, leaflets, flyers, those kinds of things. I can send those over to your coordinator and have her dispense those out to you. So I didn't focus on the elements of back to sleep in this one, but they are readily available in other formats, but I can make sure that we get you some.
If you would forward those to me, I can send them out to the group.
Yep.
Okay, thanks. Thank you. Well, I certainly appreciate you giving us this information, Annalise. I think it's something that, you know, again, young parents don't often think about. And you know, I think it's interesting and informational for us to know about the adolescents as well. You know, I don't think it's such a big shock for us with the adolescents, although the off-road vehicles does surprise me. So I think it's, as a group who tries to you know, focus on getting kids to adulthood safely, all of this information is important. So I certainly appreciate your time today.
Yeah, I think that culturally we think, you know, as of teenagers of like, you know, parents staying up till curfew or later to make sure that the kids make it home. That's kind of a cultural thing that's in all of our minds of the risky behavior of teens. And so really letting families know that actually the most at-risk time for your infant is, you know, those first 4 to 6 months, up to a year of age. That's when we're losing half of all of the children that die. So sort of a little bit of a cultural shift there of like, making sure that it's every sleep is the safe sleep. Thank you.
Your pay's Morgan.
Yeah,